You get what you get and you don't get upset.
A woman on top doesn't make a difference. Eczema, you can safely take antihistamines.
Yes.
Don't want to mention names, but there is one that is commonly, it rhymes with allergies.
Hi guys, and welcome back to another episode of ziRight Girls. I am your host, Dr. Thalia Isaacs. I'm an obstetrician and gynecologist, and I'm here with my co-host.
Hi, I'm Dr. Tembelihle Masina. I'm also an obstetrician gynecologist.
So today, in honor of pregnancy awareness, we are going to be taking you through some of the myths around pregnancy. We aim to open up your mind around pregnancy. We're going to dispel some myths, and we're going to make the magic around building your bundle of joy a little bit clearer to you.
Okay, so we're gonna go right into some myths. First up, Thalia, is there a recipe to make a boy or a girl for that matter? You don't have girls.
No, I don't have genetic girls, but I do have a daughter. I have a bonus daughter, so I've got two boys. I don't know. No, so technically no, right? You get what you get and you don't get upset. But gender is determined by your male counterpart or your male partner. So we as women, we have two X's, and if you split them in half, you will always have an X. And your male partner will have an X and a Y. So you split that in half, you get either an X or a Y. So I like to tell my patients who have had like 5 girls and daddy wants a boy that it's up to him to bring the boy. Yeah. So gender is determined by the male chromosome that you get from your partner, and that's what determines gender.
Oh, so no doing it in the morning or doing it with your socks on. A woman on top doesn't make a difference.
Not scientifically, no.
Okay, sure. All right. What's next?
So now let's talk about things about like when you are actually pregnant. I think one of the common questions that we all get is like, what am I allowed to eat and what am I not allowed to eat? We did speak about it a little bit like in season 1, but let's just go through what is safe and what is not safe.
Yeah.
Right? So sushi. Am I allowed to have sushi?
Okay, so the concern with sushi, especially the one containing salmon or trout or raw fish, let's just say that. So the concern may be that because it's uncooked, it may contain some bacteria or protozoa or parasites that can cause gastrointestinal infections. And the other concern is possible mercury in the fish. The amount of mercury in the fish that we consume is generally negligible to cause any harm to the pregnancy. But things like bacterial infections, we cannot always predict obviously the hygiene and how the fish is kept and preserved and prepared for your consumption plays a big role in that. A once-off thing should not really cause harm, but generally we don't say fish is unsafe. So you make your judgment. One meal of sushi every once in a while should not cause a big difference.
Okay, great stuff. And let's talk about cravings, right? So cravings are a normal phenomenon in pregnancy, right? But there is like a little bit of like science behind it. Sometimes when you're craving something, you might have a nutritional deficiency, and so your body is looking to replenish that. But when you have weird cravings, like out of the blue, some people come in and they say, doctor, I like a dirty orange, like it must have like sand on it. Then we start thinking like there might be like something like an iron deficiency. I've had patients come and say they like to eat raw custard. I had one patient who I asked her, so do you like to eat ice or do you like to eat soil? And she was like, no, but I love washing powder.
Yes, that was also my first time hearing about the soap or washing powder.
Yes, and then we tested her iron levels, and she was anemic.
Yeah.
And anemia in pregnancy is something that is very important to consider. One, we need iron in order for us to make blood cells for ourselves. We need iron so that we can make blood cells for your baby. Iron is also very important for your child's neurocognitive development. So in layman's terms, that is just basically like how your child is going to behave and also how your child is going to progress at school, and your child's ability to concentrate is dependent on iron levels during pregnancy. We also know that when you give birth, there is going to be an element of blood loss, whether you're giving normal birth or whether you're having a Caesar. But also we expect for you to have a period for 6 weeks. So we don't want you to like go through that, in a deficient state. So yeah, if you're having like wild cravings that are just really like abnormal, it's not of any nutritional value, then it's a good idea to have your iron levels checked.
Okay, but doctor, my baby only likes McDonald's. Can I eat McDonald's every day?
Nobody should be eating McDonald's every day. Again, it's the same like the sushi, right? Once in a while as a treat, that's good. But remember, processed foods is not healthy for anybody, whether you're pregnant or not. That's like, it's empty calories. You actually going to put yourself at more risk for diseases of lifestyle, diabetes, hypertension, high cholesterol, obesity. So talk to your baby. No, not McDonald's every day.
Okay, which then again, it brings us to another one, eating for two.
Yes.
So eating for two in pregnancy, we know in pregnancy that you are going to gain some weight, but the common amount of weight that we expect you to gain is anything between 10 and 12 to 15 kilograms. Obviously, if you're a little bit smaller, you have a little bit more leeway to play with. And this weight is distributed into, at the end of your full 9 months, your baby should be at least 3 kilograms. You should have at least about 6 to a kilogram of placenta. Should have at least about a liter of amniotic fluid. Your placental mass also, your uterine mass or your womb mass also increases because it has grown to accommodate this baby. You do have an increase in blood volume, some fat cells, and also a slight increase in breast mass. So that weight gain is distributed in the whole 9 months, that at the end of the pregnancy, you should have gained at least 10 to 15 kilograms. And that is more safe. So obviously, if you're eating McDonald's every day for the rest of the 9 months, you are definitely going to gain more of that. And like you rightly mentioned, that increasing in lifestyle diseases as well, which then become lifelong. Okay.
On the topic of, you mentioned like bacteria and protozoals, this is not about eating foods, but it just made me think of the idea of, sometimes I get questions like, we want to go on a holiday, or we're going on a baby moon and there's going to be a jacuzzi, or we're going to warm baths. Warm baths are very popular here in the Western Cape. So I get that question a lot of like, can I sit like in a hot bath, like in a hot water bath, in a jacuzzi, or in a warm bath? And Lihle, what is your take on that?
So extreme temperatures or like extreme heat can be teratogenic, but again, even if it's very hot, you shouldn't also be able to even dip your toe in it.
Yes.
Again, water that is not flowing or stagnant water is an increased risk for possible infections in general, including fungi and bacteria.
Yeah.
So there is no real harm in going on holiday and sitting in a hot bath or hot springs, but again, swimming is a safe activity in pregnancy. I feel it's safe.
Okay. So Lee, you've already mentioned that like I'm a mom of 2 boys, and my family lives out of state because I'm a Bainar, or out of province because I'm a Bainar. So I always pack like a little medicine kit, like a survival kit, like, when we're traveling, and I like to keep like, like plasters, panados and things. Is there something that you would recommend to your pregnant patients? Like, these are safe remedies that you can take, or over-the-counter things that you can take, in between your appointments, just to tide you over. What would you pack in your pregnancy survival kit?
Okay, so again, in pregnancy, there's a myth that you can't take any medication at all. Yeah, obviously, you should double check with your doctor that the medication that you are taking is safe, especially in the first trimester. But you can safely take Panado, because Panado treats pain, it treats fever, just before you get to be assessed what is the real reason for the headache.
Yeah, Donald Trump. We can take Panado.
Yes, it has, the link to autism has not been found, so it is still safe to take Panado within reason, obviously, and also you should, if a symptom persists, it should be examined and worked out by your doctor. You can take antihistamines after the first trimester if you're suffering from allergies, so chronic allergic rhinitis. If you've got eczema, you can safely take antihistamines.
Yes.
Don't want to mention names, but there is one that is commonly, it rhymes with allergies. When you're pregnant, you often suffer from nausea and vomiting. So again, nausea is a common symptom of early pregnancy. Sometimes it persists throughout the pregnancy. You always avoid the things that can trigger the nausea, so like funny smells or strong smells
perfumes.
Generally. Even sometimes it's food that smells strong for you. So we avoid things that can trigger the nausea. You've got your natural remedies like ginger. So ginger has been found to have like a significant improvement in nausea symptoms. You can get it in different forms. You can get it in ginger tea. You can get it in like some ginger sweets, like your natural or homeopathic medicines. Stony is not such a great source of ginger. It's more sugar than ginger, but
and it's very acidic.
Like you were saying, traveling, if you're on the road, anything will do at that point.
Peppermint as well.
Yes.
Peppermint increases like gastric emptying. So if you have like a full bloated tummy, that's why you get peppermints like at restaurants after a meal. So it's to help the gastric emptying. Also, I feel sometimes like it opens my nostrils. It makes me feel like I can breathe better.
It definitely does improve nausea. So like just the spearmint gum, it can also help with the hypersalivation.
Yes,
it's a safe, easy thing that you can get over the counter and nobody will question you, because whenever you're pregnant, you always get cross-examined whenever you want anything.
Sure. So we said pains, antihistamines, nausea things as well. Heartburn.
Oh, yes.
Heartburn. What can we use for heartburn?
So firstly, what causes heartburn in pregnancy?
So heartburn in pregnancy, so the driving hormone in pregnancy is progesterone. So progesterone relaxes basically everything in the body. I think all symptoms in pregnancy can be attributed to progesterone. It causes a delayed emptying in your gastric emptying, so food stays in your tummy for a longer period of time. It also relaxes your esophageal sphincter, which is not an actual sphincter. It's just a kink in your, like a kink in the esophagus.
In the structure of your food pipe,
Yeah. So obviously food can then reflux back from the... we also have more acid that is produced during pregnancy. I think we also mentioned that in our last episode with Dr. Smile, when we spoke about dental health and hygiene. So that's what's causing the heartburn. Hair in the baby.
It doesn't mean that the baby's going to have a lot of hair.
Doesn't mean that the baby's going to have a lot of hair.
Oh, mama.
Scientifically, that has not been proven to be fact. There should be more studies done to see whether progesterone causes hair growth, but heartburn itself does not cause hair growth in the baby. So that's what causes it, but what can we do about it? So I used to have like little sachets of Gaviscon everywhere. I like them. It is a little bit more expensive than buying like a bottle, but the nice thing about it is I used to have like 3 or 4 in my handbag. I would keep like a few in my cubbyhole in my car. I used to have some in like my little bedside table. So wherever I was, I had a little like quick remedy. So yeah, that's what I did.
Yeah, so mainly it's antacids to neutralize the acid in the stomach. Also, it has got a bit of a buffer layer. The magnesium also helps to basically form a layer that the reflux doesn't go up your esophagus. So yeah, mainly the commonly over-the-counter remedy is Gaviscon or Gelusil. There's quite a few brands that antacids that you can safely use in pregnancy. And commonly the heartburn is mostly in the late second and third trimester, especially when the tummy starts growing and starts pushing up on your stomach.
On your diaphragm.
Yeah.
You mentioned magnesium as well. So magnesium is also like a lovely drug to have, you know, at reach when you, like I said, in your pregnancy survival kit, because one, it helps for heartburn, but also like cramps in your legs. So like some magnesium can also relax your muscles. It's a muscle relaxant.
Yes.
So it helps for cramps in your calves, which can be quite painful.
Yeah,
if
it's
your
also common complaint in pregnancy
Yes,
as well.
Yes. Okay. Lihle. Before I got pregnant, I always wanted to have the pregnancy glow. Is there something like a pregnancy glow? Does it exist?
Well, it exists, and
Oh, okay. So it is like a thing.
yes, it is a thing. So generally, you do have a little bit more blood flow to all your organs, including your skin, which is the biggest organ in your body.
True.
So you vasodilated in pregnancy, and obviously you get more blood flow to your skin as well. So you can glow from that, and also there is increased in production of oil. So you may, for some people, they may enjoy the shine. Some people not so much. But these very hormones are again responsible for the appearance of not glowing. So sometimes your skin may even darken because of this very increased blood flow and increase in hormones. But all of this is not harmful to you or the baby, and generally it does reduce slowly after delivery. So it's not like you deliver today and tomorrow your glow is gone, or you deliver today and tomorrow your skin is back again spotless, because sometimes you may also develop conditions like acne during pregnancy, which are all caused by the very same hormones of increased blood flow, increased sebum production, and can clog your pores and you develop acne. So yes.
So just your normal routine.
Yes.
Yeah.
So this normal routine, keeping your skin clean, using pore clogging moisturizers, applying sunscreen as we should every
Anyway.
day, all year round, is the same skincare routine.
Yeah. Which brings me to another question that I also get asked quite often is like, can I dye my hair when I'm pregnant? And I've checked the research, and they say that, like the chemicals in hair dye are not in levels that should be toxic to your pregnancy. However, it is recommended that you do, if you need to dye your hair, do it outside of the first trimester. But otherwise, go ahead and do so.
Okay.
The other big thing that people are always asking us about is induction of labor. Sometimes we get to 37 weeks, 38 weeks, 39 weeks, and now you are just exhausted. You are like physically exhausted. Your body is big and heavy, like your baby is pressing on everything, and they're like, doctor, what can I do to get this baby out? Obviously, we as obstetricians, we don't want to interfere too much if there isn't like actual medical indications for induction. But a lot of patients will come and be like, what can I do at home that is safe in order to get the party started? So what is your advice?
So I always advise maintain physical activity throughout your pregnancy. So things like walking. Some people even recommend curb walking, which they say it brings on labor. Again, that is safe. It being upright, gravity helps the baby to descend and engage into your pelvis. It has not been proven to cause any harm. However, the evidence that increasing intensity of physical activity towards the end of pregnancy will make your labor easier, or it will bring on labor or induce labor. There's no evidence of that.
Eating pineapples? Can I eat pineapples during pregnancy?
If you love pineapples, go ahead. There hasn't been any harm that has been found to change any outcomes in whether your baby, for your baby, or inducing labor. So everything in moderation. Pineapples are a fruit. Fruit contains sugar, so a lot of fructose. It ends up causing increased energy storage. So you end up just gaining fat cells. So everything in moderation, but there is no harm in eating pineapple.
What about dates?
Okay, so if you love dates, for me, I find dates very sweet.
I don't like a date.
They are a good source of fiber.
Yes.
So
Great for constipation in pregnancy.
yes. So if you're eating dates for induction of labor, there is some evidence, but it's not statistically significant that it can induce labor. So eating dates from 36 weeks onwards, the people that were given dates, they did find that they did go into spontaneous labor before 40 weeks much more than people who had not been eating dates. So there is slight evidence that yes, it may induce labor, but then again, I'm not a fan of remedies that bring on labor at home, because once you start getting contractions, you should be monitored, so the dose of the dates, we don't know. How often, how much, we don't know, and we don't know what is safe. Yeah.
One thing that I will say is please do not take castor oil. Castor oil causes severe uterine contractions, and as Lihle has said, we don't know what the dose is that causes induction of labor versus uterine rupture, and we don't know how often you should be taking it, what is a safe dose. So please stay away from castor oil. Castor oil in pregnancy is an absolute no,
and it tastes terrible, and it will give you diarrhea, and
it's just
you'll
unpleasant.
be sick and dehydrated and hypertonic uterus with complications after taking castor oil.
So it's dangerous to both mother and baby.
What about raspberry leaf tea?
So raspberry leaf tea, it might taste nice. I've never tasted it before, but it has not been shown to be statistically significant in causing induction of labor. But if you need an induction of labor, one, if there's no medical indication, meaning there's nothing that is pushing you to have your baby earlier than 40 completed weeks, then discuss it with your obstetrician, and it is best to have it done in a monitored facility where you and the baby can be monitored and in an environment that is safe, right? We don't want you rushing to the hospital with I've delivered a baby in the parking lot. Have you?
No.
Touch wood.
I shy away from drama.
Touch wood. I've delivered 2 babies.
Oh my goodness.
One in PE and one in Joburg. So we don't, it's not fun. It's not fun at all. So yeah, rather if you are, leaning towards wanting to be induced, chat to your obstetrician and do it in an environment that is safe for you.
And sexy time, doctor?
Sex during pregnancy is, it's considered to be safe. There are a few particular medical conditions in pregnancy where we would ask you to abstain. So that is if you're having a threatened preterm labor, if you start contracting before 37 completed weeks, or if you have a short cervix, if you have a placenta that is covering the opening of your birth canal, then your obstetrician will ask you to not have sex during pregnancy, because we don't want you to go into labor. If those conditions do not exist in your pregnancy, then by all means enjoy responsibly.
And yeah, in as much as semen does contain prostaglandin as well, it's not significant amount to actually induce labor. So you can safely continue engaging in sexual intercourse throughout your pregnancy, but not necessarily as a specific means of induction of labor.
Which brings me to birth now. We had a question from our TikTok followers. Birth positions during pregnancy. What does the evidence say about how I should be giving birth? Should I be laying on my back? Should I be in all fours, squatting? What does the evidence tell us?
Okay, so the evidence tells us that the mother must be comfortable
At all times.
during giving birth or during the second stage of labor. And some mothers are comfortable on their backs, some mothers are comfortable squatting, some mothers are comfortable being upright. But basically, it is mainly about comfort, then you will get the desired outcome. Being on all fours does tend to increase the diameters of your pelvis. It's also a position that we use when we have some certain pregnancy complications to try and improve the size of the pelvic diameters. If the mother is able to push in that position, then yes, by all means. Again, sometimes in the settings that we are in, those positions may not necessarily work, because if you are on all fours on a bed, the baby may drop, things like that. So the main issue here is safety and comfort. So if the mother is comfortable in a certain position and they feel they can push better in that position, yes, we will support them. But also within safe parameters, if your baby needs to be monitored, so you may need to be in a certain position. Left lateral position as well is found to be much more comfortable for patients to be able to deliver. But again, you work with your team during delivery so that everybody is able to give you the best care and support as much as possible.
Yeah, I think that's very important, Lisha. It's about comfort, yes, and safety. Secondly, there are some obstetric emergencies where it's just completely impossible, right? We have an obstetric emergency known as shoulder dystocia, and in that instance, we need to get that baby out within 3 minutes. And so, to open up your pelvis, we might have to put you on your back and even hyperflex your legs to open the pelvic diameter. But if that's not the case, then whatever is comfortable and whatever is safe in that instance, yeah. Which brings us now to our bundles of joy.
Yay! Now we have a baby.
We have a baby. Lihle, I've been asked, my baby is yellow. My babykie het geelsig dogter. And I was told that I mustn't eat oranges because oranges causes the child to turn yellow. Is this a true chair?
Actually, this oranges thing is something that I only learned when I arrived in Cape Town. Oranges are a great source of vitamin C. They are nice, hydrating, sweet fruit or a treat that you can enjoy in pregnancy. There's no evidence that eating oranges during pregnancy causes jaundice. Jaundice is a very common neonatal condition, and there's different causes for it. Also, sometimes the baby, because just the baby's organs are immature, so they are not yet working properly to break down the blood cells. So jaundice is not caused by you eating oranges. You can safely eat oranges during pregnancy. If the baby does develop jaundice, speak to your pediatrician about possible causes and the treatment thereof.
Okay. And then just before we wrap up, let's talk about breastfeeding. Okay. So we've also spoken about it a little bit before, I think in prior episodes. We say that, breast is best, but fed is better.
Definitely.
Yeah. So like to help ourselves breastfeed, what can we do? What helps lactation?
So again, keeping the baby with the mom immediately post-delivery, that bond and initiating breastfeeding early has been found to be the most successful indicator of successful latching and continuing breastfeeding. So that first hour is very important for bonding, to learn to latch, and
the golden hour.
yes. So what can you do to prepare for breastfeeding? Obviously, you must be mentally prepared, because the minute the baby comes out, most of them, they are ready for breastfeeding. So some mummies may want to deliver and rest. Unfortunately, your job begins as a mother immediately when baby arrives.
Yes.
So to keep well hydrated. So again, during labor, you must be well hydrated. If you are not planning on doing any surgical procedures, we encourage that you keep eating light meals or light snacks during the labor, so that you also have energy to push. Well hydrated. There are some things that you can use that helps to stimulate breast milk. But again, the biggest stimulator of breast milk is the suckling reflex.
Yes.
So the more baby sucks, the more hormones or signals are sent to your brain to stimulate your breast to produce milk. External things like
Ginger.
Ginger has been found to be one of them. But again, shy away from the stony. The stony is very sweet.
Yeah.
Or
Natural ginger. I think natural
factory-
ginger is the best, rather than an artificial ginger flavorant.
Yes.
Yeah.
So ginger teas are again the better one.
Ginger juices.
Yeah.
Your mom can make you some ginger beer at home.
Yes.
But also
Sugar in
with sugar
moderation.
in sugar content in mind. Just be cognizant of the sugar content. Yeah.
Not if my granny makes it. She loves sugar.
Helps the medicine go down.
Yeah, so ginger.
Oats.
Yes, oats.
Yeah, so oats has also been shown to increase breast milk supply. There's fenugreek.
Or fenugreek. Fenugreek is a natural herb, yeah.
Yes, brewer's yeast as well. Jungle juice as well. So jungle juice is a combination of things that help stimulate your breast, but it also helps hydration. Because when you breastfeed, you become dehydrated, you become thirsty. So just make sure that when you're breastfeeding that you're always taking in fluids, because the fluid that you take in is actually going to making the milk which you're going to give to the baby. Yeah. Those are a few of them. There are some medications as well. So a lot of the nausea tablets that we use, a side effect of that is increased milk production. Yeah.
So yes, so if you're really struggling, then speak to a lactation specialist, speak to your doctor. Physiotherapists are also great in assisting with milk and latching and management of breast engorgement and things.
Yeah. And if you're having engorged breasts, it's also important that that gets addressed as early as possible, because we don't want you to have infection in your breasts and have breast abscesses, which are very painful and can disrupt your pregnancy journey. Your breastfeeding journey, excuse me.
So yeah, what simple things can one use to prevent or to treat breast engorgement?
So the first thing is regular emptying of your breast. So that is by actually latching and allowing the baby to drink. Then thereafter, I would say wearing a bra so that you support your breasts and you contain your breasts, because they will expand to whatever size they're allowed to. So having a bra keeps them contained, definitely. If you're having breast pain, you can do simple things like paracetamol for the inflammation, and you can do warm and cold compresses, warm or cold compresses. So a warm compress is literally standing in the shower and then letting the hot water, run over your breasts. I wouldn't say milking the breast, because the more you stimulate the breast, the more you're telling your brain to make more milk. So that's a little bit counterintuitive. And then cabbage leaves.
I love cabbage leaves. I feel like they're breast shaped.
They are like God's bra.
Yes. And they fit nicely into your bra as well. They are safe. They are cheap.
Cooling.
They are cooling. So they are a great remedy to treat engorgement.
The only thing that I will warn you about is don't leave them in for longer than 20 to 30 minutes at a time, because they also do tend to
warm up and can start smelling.
And that's that on breastfeeding.
Oh yeah. Okay.
All right. So yeah, Leslie, that is taking the mystery out of the magic of building your bundle of joy. It was fun.
Yeah. Okay, that's it. Thank you for joining us on today's episode of Pregnancy Mythbusters, from conception to delivery, and what to do when you have your new bundle of joy. So we hope we have dispelled some myths and old wives' tales regarding pregnancy. And Thalia, what are we talking about next week?
So next week we're talking all about obesity and healthy lifestyles, and we will have a special guest in the studio.
Oh yeah, can't wait.
Until then though, we hope
ziRight.